All right, we're going to do the second half of running over the syllabus real quick, and I'm trying it a little different, so maybe you can see me this time, and I'm going to share my screen with you at the same time. So we stopped at grading the comprehensive patient care. So this semester you will have one comprehensive patient care competency. That patient is the adult patient. The patient selection, you have to choose someone who's older than 18 or older. So that is your adult patient. You will go from the very beginning to the very end with this patient. So you will be graded on everything that you do with the patient. So health history, you will not be allowed any errors. Oral inspection, 4 errors are allowed. Dentition charting, we'll have 0 errors except for 2 in each of the tooth colored restorations, including sealants, recording of clinical decay, recording of radiographic decay. You must record correctly the amalgam restorations and the non-restorative chartings and the oral anomalies and the dental prosthesis. The periodontal charting, you will be allowed 3 errors. Your probe readings need to be within plus or minus 2 millimeters from the instructors. You'll have gingival assessment that you can have a few errors in. The treatment plan and case presentation, you can have 2 errors in. You can read through all of that. Do note though, remember with the treatment plan, if you don't follow the treatment plan as approved by the instructor, then you will forfeit the credit that you would have been given, and you will get a U for professionalism. For the adult patient, you will have a plaque-free score. You can have 2 errors in it. You will also present oral hygiene instructions, and the instructor will listen to you present them. This will kind of talk you through what we want to see, what we will want to see, what we will grade you on. Debridement of calculus, you will have some allowable errors. You'll just need to see the calculus evaluation guide. And then you'll have plaque and stain removal, which will have 0 errors in it. For this competency, do not forget, in fact, you may want to put a big star beside it. You may want to highlight it in bright color. Before you are done with this patient, once you've completed the plaque and stain removal, you're going to want to redisclose. So you will have the stuff that you need on your tray that you need to do another redisclose. And once you've redisclosed your patient, you need to have the supervising dentist or the instructor take a look inside and see that you've done it and initial your grade sheet. Don't forget this. This is an easy step to forget. Don't forget it. Highlight it, star it. Just remember that you've got to redisclose this patient. Once you have had the dentist or the instructor initial your grade sheet, you can go back in and you can remove the remaining stain or plaque prior to signing up for a checkout. So once you've had the dentist or the instructor sign your grade sheet, you're not quite done. All right? You still have to sign up for a checkout. The instructor still has to come over to your patient and do a checkout. Once we've done the checkout, then you can move into your fluoride treatment, and you can give your patient the fluoride that if you had it treatment planned, you can do it. Failure to maintain the chain of asepsis or failure to properly prepare the unit and instruments for the end of treatment will result in no credit for the comprehensive care competency, and all debridement points earned for the day will be negated. So when you clean up your rooms, make sure that you are doing everything that you need to do. Make sure that you do the traps. Make sure that you clean them. Make sure that you run the water through the lines, the cleaner through the lines. Make sure that you dry the lines. Make sure that you take the air water syringe and you squirt all the extra water out of there until there is no water in it. All right? You don't want to lose this requirement. This is a big requirement. The next requirement that we'll look at is the dental hygiene process of care. And this is an assessment patient. For this patient, you will go through all of the assessment steps. You'll go through check-in, and then you'll do a plaque-free score, and you're done with the patient. So this patient can be of any age. It doesn't have to be a certain age. Usually the younger the patient, not too young, but a young patient is usually easier to get this requirement done on because they don't have quite as much stuff to assess and to write down, whereas adult may have a lot of dentition that you have to record. A lot of things that you have to record, where a younger person won't have those. So this is your assessment patient. So you have the health history with 0 errors. If you, let's see, you've got oral inspection where you can have 3 errors. Dentition charting, you can have 0 errors except for 2 in your tooth colored fillings or sealants. Recording of clinical decay or recording of radiographic decay. You must correctly record all amalgam restorations and non-restorative chartings, oral anomalies, and dental prosthesis. Periodontal charting can be allowed for 3 errors. You have to have probe readings within plus or minus 2 millimeters of the instructor. You must correctly record missing teeth. 6 probe readings for each tooth, areas of bleeding, and recession. Recession has to be recorded. You have to both write the millimeters of recession. You also have to draw. So don't forget, you have to do both for recession, and then you have to record mobility if there is mobility. The gingival assessment will allow you 2 errors or 2 sextants to be errored in. You must record correctly the date, generalized and localized, descriptions of 4 sextants, and make sure you get that generalized statement. The plaque-free score, the patient will explain the procedure used to obtain the plaque-free score and the findings, and then other requirements to competency that you will need to do. So plaque-free score is the end of that assessment patient. Excuse me. Other requirements that you will need to do to competency are the FMS. Don't forget, graded with a rubric is the first one. So print those rubrics, get them ready to go. Make sure that you get a start time and a stop time. The rubric, let's see, the time for FMS is 40 minutes. So you'll have 40 minutes to take an FMS. Get the start and stop times, don't forget. The rubrics have to be completed successfully prior to attempting the other FMS requirements. So you can't do another FMS until you get that rubric done. I mean, you can do them, but you won't get credit for them. All right. After you've done the rubric, you have one more FMS that you are responsible to take and get at 80%. You have 3 FMS days. So if you don't get the FMS done the first time or the first day, you've got 2 more to go for with it. You also have bite wings. Bite wings have to be done. The first bite wing has to be done with the rubric. So it has to be successfully completed prior to attempting the other bite wing survey requirements. Once you have the first one done, you can do the other 2. You will do them to 80% competency. Make sure that you get them graded first by a peer and then by the instructor. Same survey. So you grade, the peer grades, and then an instructor grades. You'll have a digital bite wing set that you take. This is just taken to satisfactory level, so it's a pass or fail. So the instructor that looks at them will sign off on them, and it's just a pass or fail grade. Instrument sharpening, you will also have to have a peer that will say that the instruments are in need of sharpening prior to submitting to the instructor. Clinical radiographs, all of your radiographs have to pass with an 80% for this semester. As you progress in your semesters, your percents will go up, but this semester is 80%. Patient selection is indicated for radiographs. You can If the doctor will prescribe you the radiographs for your patient, then you can take the radiographs on your patient. Just don't forget, radiographs have to be prescribed by the doctor. You cannot take x-rays on your patient without a prescription, and the way that you get that is on your treatment record, and you have to go talk to the doctor and tell him that on this patient you are wanting to, and you have to take their health history. On this patient you're wanting to take either bite wings or an FMS, and you would like him to prescribe film. And after he's looked at the health history, then he can write how many film he wants taken on the treatment record. All radiographs have to be graded and determined for competency. If you don't pass, if you don't get an 80%, they don't count against you. They don't count for you. They just go in your patient's chart and they just stay there. Errors caused by patient movement or processing procedure will not be considered for reduction in the final grade. However, a radiograph with these errors may need to be retaken according to the supervising dentist's discretion. So the dentist may want you to retake an x-ray if one of those two errors happens, or other errors as well. So once you've taken, okay, if a student has taken bite wings for a patient and an FMS at separate appointments and attained competency for both, we can only give you credit for the FMS. So if you've taken bite wings on a patient and then you've decided you want to do an FMS on them, and we've given you credit for those bite wings, what we'll do is we'll take the credit away for the bite wings, but we'll give it to you in the FMS. Okay? So they just can't be separated at this point in time. So when we grade your bite wing surveys, a major error will count 10 points. A minor error will be 5 points. For a full mouth series, a major error is 2 points and a minor error is 1 point. And I imagine this morning you did some grading with Miss Curtis and Miss Eckelberger. And so this is just kind of giving you some more information here in your syllabus. Other things that we look at when we do your grading or that we consider in the final evaluation are documentation. Did you write the number of films exposed? Make sure that your medical history is completed and updated prior to the exposure of radiographs. Make sure that the number of films exposed is documented in your treatment record services rendered clinical form. If you don't do all of this paperwork or the proper documentation, it will result in a 10-point deduction from your evaluation grade. So you want to make sure that you do everything kind of right here. You want to make sure that you use the lead apron, use correct exposure settings. Failure to use the principles established will result in a 10-point deduction. Don't forget that you have to self-evaluate as well. You have to evaluate all of your radiographs. Each obvious error in the self-evaluation will result in the loss of 1 point. So if you see that you have a major error on your x-rays and you count it as a minor error, and the instructor feels that you should have known that it was a major, if it's blatant major error, you can lose 1 point because you weren't honest with your self-evaluation or your self-rating. All right? So be fair with yourself, be honest, and assess correctly. Mounting your x-rays. Each mounting error will result in the loss of 1 point. The student exposing the radiographs is ultimately responsible for mounting, even though an RA may have mounted the films. When you take bite wings with your patients, your RA will mount those films in a holder, and they will bring those films to you. It is your responsibility to check those and make sure that they are correctly mounted. Same with the FMS surveys. If your RA mounts those surveys for you, you need to correct or check them and make sure they're correct. If they're not correct, then you need to fix them. Okay? It's your responsibility, and it's your points that will be lost, not the RA's. Dull or instrument sharpening. We will do that this next week, I'm hoping, with your peer patient week. Other requirements that you will have are mounting the full mouth survey. I'm just going to go down. You've got the list here under the other requirements, and then you've got the criteria under that list. So I'm going to jump down to the criteria here. Mounting the FMS. Each student will mount a selected FMS. The student needs to inform a faculty member of the intent to complete this requirement. The faculty member will provide the student with an FMS of a clinical patient to mount. All films in the survey must be correctly mounted on the first attempt. You will be given 10 minutes to mount the survey. There is radiographic interpretation. Once again, this will be a selected FMS, and you have to record dental caries, dental calculus, bone loss, and pathologic findings using the back of the FMS grade sheet to satisfactory level. So you should have practiced that this morning with Miss Curtis, or tomorrow morning. I'm doing this the night before. But you should have practiced this grading and radiographic interpretation grading with Miss Curtis. I believe that she had an activity that she was going to help you guys do. You will need to, when you're on the floor though, on the clinic floor, you will need to inform the faculty member or the dentist of the intent to complete this requirement. The faculty member will provide the student with an FMS or a clinic patient to interpret. The findings must be recorded to a satisfactory level. The radiographic interpretation, any of these, the radiographic landmarks, they can be done with the doctor too. A lot of times the doctor is not quite as busy as an instructor, and so you can catch the doctor and he can work on these with you as well. I do want to make mention here, while talking about radiographic interpretation and the identification of radiographic landmarks and the mounting of the FMS, any of these extra requirements, you can do them. Let's see, as far as the mounting, the radiographic interpretation, the identification of radiographic landmarks on your FMS days. When you are done taking the FMS with your patient and you are done grading and you're just basically done for the day, if you have time left, pick one of these requirements and do them. If there's somebody that can do them with you, pick a requirement and do it. You also have a peer radiographic landmarks. You can do that on an FMS day. You can review the PANA with the peer on an FMS day. So use your time wisely. Get these requirements done. These requirements are requirements that have to be done before the end of the semester. And so you can use your FMS days to do so. If you get through your FMS days and you have your third one and you don't have any more FMS surveys to take, you've already taken them all, but you still have these requirements to do, you need to get them done. All right, take every opportunity to get these requirements done. These are easy requirements. They're not hard. They may be a little time consuming, but they're not hard. All right, off my box. And let's see, you've got an autoclave operation. When you are the CA in that rotation, you will do the autoclave operation. There is not a rubric for this. It is on your grade sheet, and the instructor will just sign off after watching you start the autoclave. Calculus detection and charting. Your patient has to have at least 3 pieces of subgingival and supragingival calculus, and each student will determine the location of calculus and accurately chart the topography of the deposit on the calculus charting form to a satisfactory level. Debridement, you're going to have 6 debridement points that you have to get by the end of the semester. Determination of the points is based on the chart we talked about earlier for your calculus. Peer evaluations, we have talked about those. I encourage you to go ahead and reread through all of this. Let's see. Peer evaluations cannot be completed during the same clinic session as the instructor evaluation of the same requirement. We have talked about that. So if the operator wants to get an instrumentation requirement and needs both the peer and the instructor, you've got to decide which one you want. You can't do it the same session. If your patient is scheduled all day, you could do one, maybe the peer in the morning and then the instructor in the afternoon. They just can't be in the same session. All right? Peer evaluations, where the peer records on the student's daily grade sheet, are right here. We've got instrumentation, the pre and post, oral hygiene instructions, review of the operation of the panoramic radiographic unit. With this, the patient selection can be a peer or a patient in the clinic. This is just to help keep students familiar with the operation of the panoramic radiographic unit. So the peer evaluator will observe the student operator prepare the unit and a patient for panoramic radiograph and operate the panoramic radiography unit. All right. If you don't have a patient that needs a pano, you can use the peer, but it has to be in the test mode area. You can't take a pano on a peer. The panoramic machine must be run in test mode. Radiographic landmarks are for peer evaluation, like we talked about. Peer requirements, we talked about this as well. The peer evaluator has requirements of their own that they have to get. Don't forget, you have to have instructors sign off on the grading of the x-rays, students sign off on the instrumentation and oral hygiene instructions. Peers have a grade sheet. CA, RA, and OA rotations. I am hoping that we covered some of those duties that you are to fulfill in each of those rotations. If we have not, they are in your program manual. You are able to find those and read through them. I encourage you to be prepared as you come up on the clinic floor. If you are serving in a rotation, a CA, an RA, an OA, I encourage you to read through your duties before you come up onto the floor to do your duties. We don't want you coming up on the floor not knowing what to do. It's okay during peer week to come up and say, I'm not quite sure what I want to do or what I need to do, and we'll help you work through that. After that, you guys need to be responsible and prepare yourselves by reading through your duties and be ready to fulfill them as you come up on the floor. On each of your grade sheets, there's a place for us to grade professionalism, patient management, and record keeping. We give an S or a U for each of these graded areas. And while we're talking about professionalism, I kind of want to talk about that just a little bit. Last semester in 115, we did a paper on professionalism, and you were supposed to have read through several items that I provided for you, and there were some lists of what was professional and what was not. We are getting to practice professionalism starting in clinic. It actually started last semester. You practiced it with the instructors on the floor, and you practiced it with your peers. Coming on the clinic floor, it's going to give you a chance to practice professionalism with the doctors, with your instructors, with your patients, and with each other once again. And that being said, each of you are going to serve in a peer rotation. You're going to serve in a CA rotation and in an RA rotation. Each of those rotations requires you to work with each of the operators on the floor. If there's an operator on the floor that you are struggling with, that you may not like, that you're just don't want to work with, that's going to be an issue, because you are going to have to work with them. All right, to get you guys through the clinic portion of your next couple semesters, your next year, it's going to take teamwork. Okay, and each of you are going to have to play the team member, and you have to help each other get across that finish line. It makes things go so much smoother for each of you when you play the team part. If you don't want to play the team part, it makes it much rougher on you. Okay? So that being said, let's become much more team players and work for each other and help each other out and get each other through graduation. Once you're in private practice, there will probably be people in your office that may rub you the wrong way too. But you can't not help them, and you can't not talk to them, or you will even have patients that might rub you the wrong way. So you're going to have to learn how to get along and how to work with each other and help each other through the clinic sessions. All right? That being said, let's move on into final course grades. The final course grade will be earned based on the completion of your competencies, the requirements, and your other clinical services. For an A, you have to have all of your competencies and requirements completed. You cannot miss clinic more than 8 hours. You cannot have more than one missed orientation session or CA, RA, OA, or peer rotation. You can have a maximum of 1 U in professionalism, a maximum of 2 U's in patient management, and no more than 3 absences, along with a few extra things. You have to do either an extra comprehensive care for the adult patient competency, or you have to have 6 additional debridement points. That's for an A. For a B, you have to have all competencies and requirements completed, no more than 12 missed clinic hours, no more than 2 missed orientation sessions, or any of your rotations, CA, RA, OA, or peer. You can have a maximum of 2 U's in professionalism, a maximum of 3 U's in patient management, and no more than 4 absences, along with either an extra comprehensive care adult patient competency, or a bite wing survey to satisfactory level, or 3 additional debridement points. That's for a B. For a C, all competencies and requirements completed, no more than 16 missed clinic hours, no more than 3 missed orientation sessions or CA, RA, OA peer rotations, and a maximum of 3 U's in professionalism, a maximum of 4 U's in patient management, and no more than 5 absences. No extras for a C, it's just your basics. For an F, you will have 1 or more competencies and or requirements not completed, and or more than 20 missed clinic hours, and or more than 4 U's in professionalism. Now, you can get an I with 1 or more competencies and or requirements not completed per program and clinic coordinators. So we have decided that what you can carry over into summer session, summer clinic, is either the adult patient, the A to Z patient, the adult patient that you start from the beginning to the end, 1 FMS survey. You can carry over 2 bite wings, or your debridement points, and your debridement points. These are all kind of patient reliant competencies, so we rely on our patients to get these completed. And so these are the 4 things: the adult patient, 1 FMS, 2 bite wings, and debridement points. Those 4 things can carry over into the summer session. When we carry over, you will sign a contract saying that you will finish these requirements before halfway through the summer session. Summer session is 4 weeks long, so you've got 2 weeks at the very start to complete your spring requirement that you didn't get done in the spring. So I encourage you to get all of it done as you can, because summer's a real short time and you will have summer requirements on top of whatever you carry over as far as that goes. I think that's all that I had to say about that. All right, students are required to achieve a C or better for you to go on and move into the next semester of classes. If you fail to get the C, you will receive a failing grade, and the students may be able to retake the course during the following semester if space is available in the class. Sorry, the dog's barking. Then we have the dental hygiene competencies, the relevant terminal competencies, and we have just a few extra things that you can read through. The attendance and tardiness is in your handbook, your program manual, but I do want to say that if you are the operator or if you have a rotation, if those are your duties for the day, you need to be on the back side of the clinic by 8 o'clock. We allow you to come into the clinic at 8. If you walk into clinic late, by 8:10, you will receive a U in professionalism because you are late. If it is at 1 that you are supposed to be in clinic and you walk in late, you will receive a U in professionalism. We expect you to be on time, and we want you to be there waiting to be let in when we open those doors. Now, when we see peer patients starting Friday, those of you that are scheduled to be the operator, or if you're scheduled to be a CA or a peer, you will need to be at the clinic door behind in the back at 8 o'clock, and then once again at 1 o'clock. The operators in the morning will not be the operators in the afternoon, so you will probably be patients. Now the patients will wait in the front. You'll go out and you'll sit in the chairs in the front, and you will wait on your operator to come pick you up, to come out and get you, to bring you back, and to seat you. I think that is probably all. I do want to say that the last day to withdraw is April 23rd, but we do not want anybody to do that, so but we just have to let you know. And I think that is all. You can read through the rest. A lot of the rest is all campus information, and then the relevant terminal competencies. We have those again up here in the top part. So if you have questions about your syllabus, just let one of us know. We'll be happy to answer. And like I said, the week of peer patience is for you to learn, and we'll help guide you through the best that we can. So I will see you guys tomorrow morning, Friday morning at 8 o'clock.